Hi, I'm Jen, and this is my discussion for Hillside being faced with a potential financial crisis and is looking at workforce reduction measures. The CFO and the VP of Human Resources have been providing some guidance to the CEO, and they're asking for us to provide additional thoughts on how you would handle the issue. Hillside ethical issues include for under organizational implications, I would have to say that we need to do a debt to income ratio on all the departments to determine whether there is a department with a higher than expected debt to income ratio. I know we talked about this in the past about what can we afford to help and who can we actually help. So that would be something we need to look into. Just at least start with those numbers, because if there is a department that we can close down where they can also get help elsewhere, that would be beneficial. To continue on, these are difficult decisions, and it would be better to have a board provide input and even vote on it than just to have the CEO decide on a course of action. It is also likely that downsizing may have to occur in upper management. I did read a recent study that said upper management is a very costly part of healthcare nowadays. So unfortunately, the upper management may have to be looked into, downsizing or right-sizing them. And for this decision, though, the CEO will need to look at that information independently to avoid bias from the board members. I think it would be appropriate to ask the employees if they have any input. Most of the time, if you're thinking of downsizing or right-sizing, the employees already know about it. If they have any ideas for cost saving, they could have cost saving ideas we haven't even considered. We could ask for their input anonymously, do one of those monkey surveys, or it could be with the person's name attached to it, depending on if they want the board to follow up with them or not on their ideas. The different employees see different things day to day that upper management may not be aware of. There also needs to be adherence to the hospital's admission and ethical standards and their value statement. The value statement from the case study that I got was to improve the health of the community. Well, it's kind of vague, but that's what mission statement, that's the one I got from the reading. The CEO did recall that most people do not believe the quality of care has improved in the facility recently. One survey, not especially on this at Hillside here, but one survey did state that up to 40% of Americans believe the quality of care has declined in the past 5 years. However, the CEO, it looks like he does realize that the goal is to ensure proper care and is provided and available to those who seek it. In the business of hospital or healthcare, people receive these services before they are aware of the cost. And even the federal government's working against us here because it prohibits the assessment of financial status before providing emergency treatment. Management's roles and responsibilities in this, it's difficult to determine if right-sizing is the only solution to the problem until after a complete analysis of the cost of the facility is completed. I've seen where certain units of the hospital have closed down as it's more expensive to run the unit than there is income from the patient's payer source. This would be information the board would also need to consider. It is also one of the only factors, so downsizing or right-sizing or juggling staffing around is one of the only factors that are in the control of the hospital. The hospital is not able to control the insurance reimbursement rates, the need for ambulatory care patient classification coding. That's a new thing that if they want to get paid, they have to do it, and other federal government mandates, which I think they come up with a couple more every year. The other concern is that the primary goal for the hospital is to improve financial viability. The organization is measured on financial viability that is essential for long-term success. Unfortunately, with healthcare today, the cost of healthcare often exceeds reimbursements. When it comes to clinical quality, the question brought forth in the case study is how would the decision to cut back be decided from a clinical standpoint versus a business standpoint. A hospital is a business and it needs to run as a business in order to stay open. However, the hospital is there to provide clinical needs for the patients, which of course do not have financial stipulations or costs associated with it normally, nor should it sometimes, but that's a different subject. The other concern is if the wrong decision is made relating right sizing, then clinical quality care could suffer, leading to more deadly complications. If the wrong decision also might contribute to decreasing quality in care, and that can have terrible consequences for the facility, and they might not even get patients, except for the Medicaid patients, which of course we know have the lowest reimbursement rates usually. Community health must be a priority. The mission statement includes, so their goal for the building is to improve the community health. They got to be able to get to the community to help the community. The community health programs can be deemed unaffordable at times, but these are often necessary to keep down the cost of medical care provided at the facility. The one thing with this community outreach clinic is what it sounds like they have here. There may be government grants or funds that could help with this type of program. There might also be a private donor who will support this for some tax benefits. Sometimes you just got to reach out and see what's out there. These types of programs are often essential for community members, and if canceled, this could lead to mistrust between the community members and the hospital. Of course, everybody is aware that the ACHE has issued an ethical policy statement, or policy on this or similar health issues. Of course, they're recommending that we recognize that cost reduction efforts must be appropriate. If they are too aggressive, the consequences for patients, family, and the organization can be as harmful as doing too little or proceeding too late. They also need to explore and evaluate best practices from similar organizations, which could help design, implement a workforce reduction plan. Best practices can be identified by conducting a thorough literature review, attending seminars, and speaking with colleagues. They're also recommending that we obtain input and advice from senior management and human resource leaders on the number of different positions that can be reduced, which open positions should not be filled, and when and how communication regarding the reduction plan should be made. It includes other key components such as discussing the rationale and process with the organization's governing body, medical staff leadership, and if necessary, the media. Of course, like I said, we can also compare, get input and advice from other hospitals as well to see what worked. Let's not recreate the wheel unless we have to. Consult with the labor council or labor union in this case. Determine how to review the impact of right sizing on the different aspects of the company or the hospital or the center. The next one is utilizing the toolkit. Look at the 6 multi-step processes for ethical decision making. These do, of course, kind of repeat themselves, so we already looked into the previous area. But Hillside County Medical Center is a 475-bed teaching hospital that serves at least half of the population of 500,000. It receives no financial subsidies from the city or county. It has many different specialized units that we will be evaluating. Its emergency department has 80,000 visits per year. Huge. In 2010, the facility started to have a decrease in income secondary to reimbursement rates and increased competition. It also has a higher than usual benefits and pension cost secondary to the labor unions. In 2015, there was a financial loss total of $7 million, most likely secondary to the decrease in reimbursement, uncompensated care, increase in competition, rising personal cost, and the depressed economy. Step 2, we're going to identify the specific ethical question that needs clarification. Does right sizing need to occur to save the facility? Most likely it is when it's going to happen, or what department or staffing issues come with right sizing. So having to look at everything and see where it is and what's going on. is our ethical question. Under step 3, we consider the related ethical principles and or organizational values, as we said above. According to the case study, the mission statement of the hospital states its goal is to improve the health of the community. Step 4, determine the options for response. Well, we could close a unit that doesn't keep their full census or that is more costly than beneficial. We could lay off some lower seniority staff, but also help them with finding a different job, as it's only fair. And possible demote or lay off vice presidents. I see that there are CEOs, there's presidents, and there's vice presidents. That might be a little costly for one department to handle. So we may have to lay off vice presidents, or like the vice president of nursing or the vice president to the CEO, and shift more responsibility to the president of nursing or the CEO. Step 5, recommend a response. I recommended kind of a long one, but it's a complicated issue. I would first examine the different units or programs on the hospital that are costing more money than they're making. Then I would start to look at positions that could be eliminated and relocate staff, such as taking nursing management and transitioning them to the bedside. This is not something any of us really want to do to get back to the bedside, but unfortunately, when times are tough, it might be something that needs to happen. Finally, I would work with the unions to determine the appropriate method to either create a small decrease in the wages across the board, which you might not be able to do with the union, or layoffs. And finally, part 6, anticipate the ethical conflict. Oh, there's going to be a lot of ethical conflicts with any changes in this facility. If a unit has to close to keep the hospital running, why are the other patients on the other units, why is their health care more important to the people that just had their unit closed? And also, what nurses are more deserving of a job when compared to others? And then, will patient care suffer more with fewer nurses? Should you leave the nurses alone and go for other different departments? That is all I have on that situation. And then I did want to pose a question. What departments do you think in the hospital would create the most cost with the smallest reimbursement rates? Thank you for taking the time to listen.